We were expecting the birth of our second daughter when we were told that she was diagnosed in the womb with stage 4 neuroblastoma, which is a very serious pediatric cancer. Now, 10 years later, and after a lot of surgery and chemotherapy, she's cancer-free.
During that experience, he was able to experience firsthand really some of the challenges within the healthcare system. The difficulties in transitions, the ability to get good, valid, very pertinent and specific useful information and education pertaining to this very uncommon and rare disease. And he remembered that, and he wrote those ideas down.
He is this hidden gem. He runs this great corporation. But when you hear about his story, he and Candace and their child, and how they had to navigate through cancer, and then what they wanted to do as a couple and as individuals to make sure that no one following them had to go through the same experience.
When a patient hears that diagnosis, you have cancer, the first thing that they're going to do is want more information.
I think that fear and confusion and apprehension all get in the way of a good result. And that's what we're trying to address. We're trying to step in the most orderly, organized way that we possibly can and support whatever the need is that arises with that patient and anticipate the need.
Receiving the patient appointment guide in the mail within 24 to 48 hours really helps those patients know who's my doctor, what does my doctor look like, who else is on my care team.
The great thing about this system is you will now walk around the hospital and see everybody carrying their first Uhlig guide. It's a yellow guide that has their caregiver's picture on the front and their name on the front of it. It's designed specifically to provide information that's most pertinent for that particular patient. So they're not having to go through unreliable internet sources and friends and other family members who are well-intentioned but may not have the most accurate data or most safe data for that patient to follow.
The Uhlig Corporation and Patient Resource, who's the publishing company of the information, are wonderful people. Mark and Candace are both very heartfelt, they want to give our patients everything that they need to help them through this journey.
Mark has been so special to the University of Kansas Hospital in so many ways. I appreciate his ongoing support through his contributions with Treads and Threads.
Treads and Threads reflects a lot of what I like most about the hospital. I think it's very collaborative, I think it's very innovative, and I think it's exceptionally well run.
He serves on the steering committee for Cambridge North, and there are so many ways that Mark and Candace want to make a difference for our patients.
When you talk about big initiatives like Cambridge North, people tend to talk about costs and they tend to talk about budgets. But I think that's looking at the wrong side of the equation. I think that what we should really be focusing on is the benefits that we get from that kind of investment.
Mark understands that being absolutely committed to the cause that we have here means you have to step up in every way possible. Lots of companies present, or help a time or two, attend a dinner or that, but a real special company gives up free of what it does. And Uhlig Corporation has done that for Treads and Threads. It has done that for our new Cancer Alliance. It has done that for patient platform programs.
We've been very fortunate to work with Mark, and I think what you have is one of the rising stars in Kansas City.
It is very rewarding to work with people you respect, to work hard on something that you believe in. This award means so much to us, and on behalf of all of our team who work on this program, very honored and very proud to accept it.